Hey everybody, welcome back to Burst TV. Today I have Miss Lynda Sherman from Ohio. She is an FDA. So before we get into that, I just want to introduce her and say hello and how inspired I am by her enthusiasm for everything dentistry and prevention. And she's doing some really cool stuff. So we're going to talk about all that today on Burst TV. Lynda, before I get into really introducing you,
okay,
I have a super important question. So just tell me when to stop.
Stop.
If you could go back to an earlier school year in your life, would you? And which year would you want to go back to?
Oh, absolutely. That is a quick answer. Absolutely. What year would I go back to? You know what, very quickly. So I was going to say 7th grade, maybe the latter part of 6th grade, 7th grade. I'm going to tell you why. So I really enjoy being athletic, and I was trying out for the basketball team. And I went to Pickerington High School, and they had a super phenomenal girls basketball team. I mean, they made it to states multiple times. So it was a big deal to be on the basketball team. And I played sports elementary school all the way up. So here I'm trying out for the team, right? And I think I'm a cool chick. Well, lo and behold, Lynda doesn't like to focus on things. Lynda likes to be silly, right? Mm-hmm. So I remember this one moment, and in all honesty, Charlotte, it probably changed the trajectory of my life. I don't know, but we're given an instruction on how to do a drill.
Yeah.
And you have to be a show off, right? And I want to be the very first in line to show off my basketball skills. So the coach is telling us the drill and how to do it and blah, 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 yada, yada. I'm not paying attention. You know what? I'm just being silly, Lynda, and I'm socializing. I'm kind of dancing around in the line, not paying one bit of attention to how to do that drill. But I had to be first in line. So whistle blows, time to do the drill. Did I have any clue how to do it? No, I had no clue. And you know what? I'm sure that my goofiness or lack of being attentive made or broke that choice. You know what? I did not make the basketball team. Did not.
But at the same time, every single person behind you learned a lesson that day. Don't be like Lynda. And since then, I'm sure you learned the lesson. Like that's a disappointment, but that's real life. Like you got to pay attention. I remember one of my friends was in tears. It was probably about the same time. I think that's just when maybe our hormones are kicking in and we're just like being goofy and trying to deal with our own stress. So it was the typical 10 question pop quiz, right? And the teacher said, read all of the instructions first. Don't start until I tell you to turn the paper over. So pass out the paper to everybody. We had our hands on the top of it, right? And he said, okay, begin. So we turn it over and the instructions were right there. Read all of the instructions first. And it was like, it was math, English. It was kind of like an assessment of all the things you knew, right? Well, the last instruction was if you read all the way to the bottom, put your paper down, write your name at the top, put the paper down, you're finished. So there were maybe only 5 of us that were finished within a minute or two. And then everybody's scrambling, like they don't have calculators. There's these hard math problems. They're wondering like, how can they be done already? Did we just give up? And that was a lesson for all of us. Like, read the instructions. And to this day, I still tell people that story when I'll send out an email to someone that just wants to submit content or whatever. And it's really defined like what I need, parameters or whatnot, but people don't, they kind of browse through it and do their own thing. And then they'll have a question. It's like, did you read the email? Because it's right there on the emails.
I know. You know, I've done that several times, like cooking for Thanksgiving dinner. You know, I remember making this cheesecake one time and I didn't follow the instructions all the way.
Yeah, and with baking, like that's why I don't like to bake. You leave out one ingredient and it's a disaster.
Well, this is more like how long it took to cook. Like it was one of those cheesecakes you had to put in a pan of water, and every half hour you had to lift like this lid of aluminum foil to let the And I mean, whatever. I was up all freaking night, like literally it's like a 6-hour ordeal. That's the part I didn't read. I got the cheesecake made. I just didn't
You
read
got it done. I would have probably just gone to the store.
Yeah.
Like, let's hit up Village Inn.
And the sad thing is I've done that several times where I just haven't read it all the way through. So I get you. I've learned now, read them all the way through. Like,
well, yes. Linda's just Lynda. You would not be the same person though if you went back. But I love
I'm maturing. I'm getting better.
That was a lesson. I love it. I love stories like that. So this is all entertaining and everything, but what I really want to talk to you about today is, when along my normal Facebook stalking, like we all do, I saw some incredible restorative procedures that you were able to do.
Yeah, thank you.
And like life-changing stuff. People come in and they're bombed out cavities and looking at those, I'm like, oh man, and I can see that you were so excited, so amped to be a part of that process. And so I need other people to see that. So I'm going to share my screen for just a second. So we've got your typical ortho case. I'm guessing they had to get debonded for a little bit in order to do some of this restorative. So this is before, and this is after Lynda.
Isn't that great?
And the help of your dentist. I'm sure that this was definitely a team effort. But here's the next one. I mean, this guy, I look at that and I'm like, wow, we've got a lot going on here.
I remember exactly who he is too. I remember his name completely. Like, no, it was, and he was a soda drinker, and I remember him. That was fun.
Yeah, and that's what I love about this is like it tells a story. People that have been in the industry for a long time, we're like, okay, is this just poor home care? Are they drinking soda? Are they mouth breathing? We like to investigate the people that are like really interested in this stuff. And this little guy, this happens so often. So did this happen before these teeth came in, which is a developmental issue?
Yeah, those were developmental anomalies. Yeah. Yes, both those two front teeth. Yeah.
And how amazing he'll feel after having gone from this to that.
I know, right? I mean, it's a self-esteem issue. This little kid in elementary school. Yeah, I mean, they don't want to smile. They get made fun of.
Yeah, exactly. This is the picture that really caused me to reach out to you. Teeth have been prepped, and then Lynda comes in and gets the chance to be an artist there, really. So when I saw the picture, I was like, oh, let me investigate, because I'm at a clinical now, and it's really been a while since I've looked at laws and rules and regulations across the United States, because we're not all on the same page. Every state is different. I'm gonna be honest, when I looked at expanded functions dental assistants and the criteria to get a certification or what that entails, I'm gonna share my screen again because I did find a resource. There are a few out there, but one of the websites that I came across, it caused me to be even more confused. We'll just jump to Florida since I live in Florida. We'll go there. Our expanded functions dental assistants, our dental assistants can take x-rays, apply fluoride. Expanded functions is really, maybe nitrous oxide monitoring, coronal polishing, removing sutures. Really not a lot. And then you're lucky enough to be in Ohio. So you can get board certified as an expanded functions dental assistant. Tell me about this process and how it's different than being on the job trained or getting a certificate. What was that process like for you?
To obtain my license as an EFTA, is what we just call ourselves, EFDA for the auxiliary, you have to start off with some type of dental education to begin with. So you just don't apply for the program. So whether you are a hygienist or a certified dental assistant, and you also have to be working in the field for a minimum of 2 years.
Okay.
It also comes with 3 letters of recommendation from ADA, accredited doctors or members, whatever that is. So you apply for the class. And I did it a few decades ago, so I still had to follow that regimen, apply for the class, get accepted into the program. I went to Ohio State University. It is considered a continuing education program. It is for 6 months. It is 1 day out of the week. So for the first 3 months, it is non-patient clinical, type of don't work. And then the other 3 months, we work with the dental students. So, I mean, pretty easy process, a great process. And the education, I think at that time was about $4,500 to do that.
Not bad. I don't know where we're at now, but
I know.
A little bit.
And I mean, again, that was a couple decades ago. I mean, a little over 20 years ago. Now I know that they do have to have some hands-on skills when they apply. So now I think the application process is relatively similar. And I'm speaking for OSU. It's just really common because I'm in Columbus. Ohio State is right here. The majority of us will go there. I mean, I know there's one outside, but I can just speak for how we do OSU. But the bottom line is whether you just had to be a certified assistant, dental hygienist, working a minimum of 2 years, as well as have 3 letters of recommendation to get in. And then now there's a skill set test.
Awesome.
Approved.
So yeah, and that's what surprised me is that you've been doing that. You've been doing this for that long. And I
want to share too, I did have to take a board's exam. So they just didn't give us a certificate.
Right. You're like, okay, here's your piece of paper. No. There you go. Yeah.
Legitimately, I had to fill so many teeth in a certain time frame and pass that with, so.
And I think that's a question that a lot of people would have because in Florida, we're fairly restrictive. But have you come across any, we'll get to the really positive stuff, but have you come across any negativity in the dental industry?
Not really.
Probably not in your area because it's been around for a long time and it's something that you and your doctor work together. You get the patient in, come up with a treatment plan. You are not prepping teeth. You're not removing decay. And I think that's what people need to also have a clear picture is that they prep and then ready to go. You can do all the restorative.
That's correct.
In my mind, that's the fun part.
Oh, it's the best part. It's creative. I mean, it's artistic work. So it's so fun. I've only had a few patients ever question it. And like, seriously, as you're talking, I think there's like 2. One wanted the doctor to do it because they felt that they are paying the doctor. So they wanted the doctor to do the work. The other one just questioned me about using a handpiece in their mouth. And once I just educated them who I was. And again, of 20 some years, that's the only patients that I know of. Usually they request. I mean, there's a request for me.
Yeah.
On the other hand, from a dentist standpoint, again, the EFTA has been something I think in Ohio that has been applicable since the early 80s. I think at the earliest. So, I mean, most people I think are receptive to it. They either use it or they don't. They don't use it. They probably don't share their opinion. And I mean, I've had a few doctors that don't feel that the skill set is appropriate or they don't have trust. It's very few. And you know what? I really don't care. I mean, we all have our own opinions, but the bottom line is I'm a damn good clinician. So
exactly.
Profitable in your practice and utilize me, that's your own problem.
And yeah, to your point, if you're in an area where this isn't allowed at this point, I would really like to see on a national level everybody get on the same page about this and all the benefits to the patient and to the practice and making the best use of your time and the patient's time and allowing the dentist to do procedures that can't be delegated to someone else. I think it's a very productive and very impactful way to use and also as far as professional development, being an assistant and having the ability to do more, or being a dental hygienist and having the ability to do more. I know chairside, whenever I'm doing all this preventive work, which is great, that's what I got into it for and I enjoyed it, but sometimes I just see a little class 5 and I'm like, I really just want to get that fixed right now instead of wasting the time and having the patient come back for that procedure because we don't have the time in the doctor's schedule. So I think there's a lot of benefit to that. So as far as hand pieces go, are you limited to a high speed or low speed hand piece?
Not at all. Nope.
Okay. So it's just whatever you need to do the best job for that patient at that time. Yeah. And there are so many dental materials, and not to play favorites to brands, but like I can't imagine how many options you have for making things look just perfect.
Oh, the options are endless. I wish that every company would send me products. So whoever's watching, totally, like I would love to do that. because when it comes to anteriors, that's where it makes a difference. At the end of the day, a posterior composite, it's a reputable company. It's all right.
You want some strength to it. You want it to be long lasting as well. Yeah.
You got it. And it's how it handles. I mean, that's a lot of our preference is how it handles. I mean, there's different viscosities, but the anterior teeth, that's where it makes a huge difference. When we go back to that before photo of the young child with the two, anomalies on 8-9, I can look at that now, the after picture, and I can think of how to want to change the composite if I had different composite to use, because there's different translucencies for dentin versus enamel.
Yep.
Same thing with bonding.
Stack those two, and there's that changes all the time. All the options that we have that are coming out in that.
You layer a lot when you do interiors. You want to layer a lot, so that's fun. Again, that's the best part. Is so artistic, so creative. It's wonderful to see the end product come out, and you can't tell where that restoration is. And again, it's all about your own eyesight. I mean, you're not using the shade guide. It's experience. It's to know how the shades come out at the end, and polishing too. There's a huge difference when how composite polishes, and you're going to use something different on the posterior tooth. I think like any specialty, you are very drawn or passionate about that specialty.
Yeah.
So I find out with dentists, especially the ones who don't want to indulge, and after, I'm really good at what I do. So my restorations, I'm very attentive, even for myself, because, like many of us, I don't want to be judged poorly. And my name is on that restoration. I mean, a hygienist is going to see it next, or they go to another office, another hygienist, another doctor, someone's going to see that restoration next. So I'm going to do a really
good point. That's the key there is like, if you've got a dental assistant in your practice that's not interested in doing the restorative, they don't want to have their name stamped on that, that's fine. But I really think this is an opportunity that we need to open up nationwide so that more caregivers who are interested to do this, that's what their passion is, like you. And that's why I wanted to have you on, is to help inspire others. And, only over time and collectively can we make some changes. I'd like for this to not be so confusing when we go to these resources to look at.
Right? I know we talked about that. Yeah.
Let's just all get on the same page. It would make it so much more easy for all of us. So there's one other thing that your passion also delves into. You have a nonprofit that I'd like to talk about a little bit. So tell us about that nonprofit.
So I've recently established a nonprofit, and it is tax exempt, which is a huge accomplishment through the IRS. So I am very passionate about prevention. I mean, we do know that tooth decay is 100% preventable. And as an EFTA, I'm restoring teeth. I'm restoring bombed out teeth. And every day I'm watching this, and people complain, right? Nobody wants to be at the dentist. And I think that somebody needs to make a change. In dentistry, we're guilty. We're not guilty. I don't do this. Other individuals are guilty for thinking that prevention is access to care, but it's really not. We need to prevent it to begin with. So thanks, Charlotte, for asking. I did decide to establish a nonprofit to change the world, and it's called the Dental Oral Care Project, the DOC Project for short. And our mission is to inspire the world to live a dental disease-free life. Our motto is to put a toothbrush in the hands of every individual. We're spoiled. A lot of us don't realize that so many individuals do not have a toothbrush.
Or they're sharing them.
Yeah, I've worked in an environment where, they can't afford a toothbrush, or their priorities are just in the wrong spot. And you know what, we got to make a change, and tooth decay is preventable, and it causes so many other issues. We all know that. I don't want to, bore anybody, but we know it has a lot to do with your confidence, by far. It's a mental thing. It's a health thing. It's a systemic thing. So, I'm gonna use my big mouth, hopefully, to change the world, and hope we can focus more on preventing and not giving access.
Yeah, in this case, I want you to use you as an example and be like Lynda. Not like that where you don't want to be like Lynda. In this case, we want to be like Lynda. We want to be outspoken. It is heartbreaking that, especially in children, in all the years that I've been in this industry and decades before me, the statistics for childhood decay have not changed much. We have to do something different.
Absolutely.
Using fluoride toothpaste and going to the dentist, it's helping, but it's not doing what we need to do. We need to have more people like you branching out into the community and really making a long-standing change.
You know, kids die every year. I know that it's not something that we hear about a lot, but kids do die every year under general anesthesia. They are put under because they need complete rehab. And, you know, Charlotte, one of the things that really ticks me off is that when you read articles about this, they focus so much about wanting to sue the doctor, the dentist. It's a very negative approach. However, I just want to say, parents, you know what? It was your fault. I'm really sorry to say, but it was preventable. I'm really sorry that it happened, and it's a misfortune. And there's not one kid that should die. And also, there's not one kid that should ever be papoosed. There should never be one kid that is fearful to be at the dentist. I mean, there's no reason for it, right? We should have a wonderful experience to be polished, get in the toy box, get a new toothbrush, and go home. That's what the dentist should be about. And it starts at birth, but it should be for all of us, even our age and our grandparents. It should just be that simple. Go in, get the tartar removed, polish them up, get a free toothbrush and a sticker, and call it a day.
Yeah, because like you said, it affects everything. It
Yes.
affects your personality for the rest of your life. It puts patients at risk for just about every medical condition that you can think of. It is going to be related to inflammation, infection, bacteria, which stems into viruses and just a slew of medical issues that people have. It all literally starts in your mouth.
Yes.
So I want to thank you, Lynda, for being Lynda.
Thank you.
And for being outspoken and inspiring other people.
Thank you.
If anybody watching this, if you're a dental assistant and you're an expanded functions dental assistant, just let us know in the comments what state you're in, what you are delegated to be able to do, because I'm super interested in this, and what you would like to see happen. If you're interested in doing work like Lynda's doing, also leave a comment. Lynda, where can they reach you if they'd like to ask you some questions on the side, not in a public space?
You know, we're all on social media on Facebook. So my nonprofit does have a Facebook page, and it's simply called the Dental Oral Care Project, as well as, you know, it has a website, which is the docproject.org. So either way, I'd love to hear from you guys. I mean, absolutely. It's keep the trend going. Prevention definitely is key.
Yes, exactly. Thank you so much, Lynda. Everybody, thank you for watching. And of
Thank
course, if you're brand new here, hit the thumbs up, subscribe to our channel. If you want to get involved with Burst TV, I'd love to have you on. Thanks and enjoy. Have a good day.